Levi, Arnold here, gonna do my midterm practical. All right, so I have my patient here, and I'm going to inspect the skull first. Okay. All right, nothing seems out of the norm. All right, now I'm going to palpate the skull. All right, was any of that tender?
No.
Okay, sorry, I'm supposed to. Okay, hair texture is pretty normal there. I will palpate the temporal artery now. Okay, I can feel it bilaterally. All right, now I'm going to inspect the face. Yeah, no, nothing seems out of the norm. Everything looks good. No huge lesions or anything. All right, now I'm going to do the TMJ from the front. Okay, got it right there. Can you go ahead and open your mouth and close it? Go ahead and open it one more time and close it. Did that any of that hurt or is it tender? Okay. Go ahead and clench your teeth. Unclench. And clench one more time and unclench. All right. Can you close your eyes? Tell me if you can feel this on one side, both sides, or no sides.
Both.
Okay.
Both. Both.
Okay. V1, 2, 3 sensory is good. Can you show me your teeth? Can you raise your eyebrows? All right. So cranial 7 is good. Now I'm going to inspect the neck. So anterior looks pretty good. The posterior looks good. I will palpate the posterior part now. Okay, I don't notice anything out of normal there. Now I will have you, was any of that tender when I was palpating back there?
No.
Okay. Now I'll have you raise your shoulders against my force there. Okay, that's pretty good. Cranial nerve 11's intact. I'm going to palpate the thyroid. Can you lean your neck forward just a little bit? Okay, and then 3 fingers there. Okay, can you swallow? Okay, and I'll do the same thing on the other side. Can you swallow? All right, that was all. Everything moved when it needed to move. I'm going to palpate bilaterally the 10 lymph nodes with 3 fingers on each. So occipital's good. And pre-auricular. Post-auricular, of course, because I'm behind it. Pre-auricular. Tonsillar. Submandibular. And then the submental. The superficial cervical. The posterior cervical. All right, will you flex your head this way a little bit? And then the deep cervical. Kind of hard to feel that one. And then flex this way. Yeah, it's still kind of hard to feel that one. All right, will you kind of scrunch your shoulders up like that? And then the supraclavicular. All right, that feels good. All right, now I'm going to do your eyes. So, about right. Let's get down a little bit lower. All right, so focus on my nose, and I'll have, so can you close your eyes with 1 or 2 fingers, and don't push so hard that you're going to be hurting your eyes or anything. I'm going to wiggle my finger and tell me when you can see it.
Okay. Right there.
Okay?
Right there.
Okay?
Right there.
Okay?
There.
Okay, now switch sides. I'll give it a second for that eye to get back to normal.
There.
Okay?
There.
Okay?
There.
Okay?
There.
Okay. All right. And now I'm going to shine my light. And so just go ahead and keep looking up my nose. All right. And the shine reflection is in the same bilateral, so that's good. Okay. Now on this one, I want you to follow my finger, but don't move your head, just with your eyes. So about 1 foot. And let me know if any of this you see double vision. Any double vision anywhere?
Just when you got close.
Okay. Now I'm going to go ahead and take a look at your eyelids, eyebrows, and eyelashes. And nothing seems out of norm. Looks pretty natural. Looks pretty healthy. Now I'm going to palpate your lacrimal gland. And so I don't get your eye or anything, can you go ahead and close your eyes? Okay, that feels pretty good. I'm going to go ahead and get your nasolacrimal duct, see if there's anything, any buildup or anything, which I don't see any, or I don't feel any either. Okay, now what I'm going to do is I'm going to put my thumbs right here and hold down. I want you to look up, I want you to look left, and I want you to look right. Okay, your sclera looks good. I don't see any conjunctiva or anything. I'm going to get my light back out. And I want you to just look straight ahead.
Like behind you?
At my
Just
nose,
behind you?
straight
Okay.
ahead, yeah.
Okay.
Okay. Okay, so working on both eyes on both sides there. Okay, now what I want you to do is I'm going to be right here. I want you to focus on my eye when I want to, and then pick up a space on the wall back there. So when I say finger, nose, or finger, wall.
Okay.
So finger, wall, finger, wall. Okay, it is accommodating as needed there, so that's good. So now I'm going to get out my ophthalmoscope. Oh, there it is. Got it. Okay, getting the light just where it's not going to be so bright, but just bright enough to where I need it. Looks like about right there. I'm going to get it in focus. Looks like right about there. Okay. Alright, so on this side, I'll get on this side. Just look straight ahead for this one. Alright, there's that. Okay, now will you look into the light? Okay, go ahead and get the other side. Look straight ahead again. Okay, now look into the light. Okay. All right. So when I was having her look straight ahead, I noticed that the optic disc coloration was good. All the arteries were good. And when I had her look into the light, the the macula was there and looked the way it needed to look. And the cup to disc ratio was pretty good. All the quadrants were good. There were no hemorrhages, or I didn't see any exudate or AV nicking. All right, let's go to your ears now. All right, I'm going to palpate your ears. Let me know if any of this is tender. Any tenderness anywhere?
No.
Okay, I'm going to go ahead and get your mastoid process. Is any of that tender?
No.
Okay. All right. Let me switch up the piece here. So it's an auto scoop. There we go. Put on a piece here. There we go. Lights on. Okay, now we're ready. All right, now what I'm going to do is fold the black pencil here. Sorry, wrong side. Start with this side. All right, so we go ahead and laterally flex away just a little bit. I'll pull the pin up and out. Okay, membrane color is good. I don't notice any buildup of any kind. No horrible buildup of earwax or anything. Looking good there. Oh, I did see the cone of light too. That was good. So same thing, laterally flex away just a little bit. Pull the pin up and out. Sorry. Fold like pencil. Okay. Cone light is still good on this side. No, there's no inflammation. There's no horrible buildup of earwax. So that side looks good also. Let's go ahead and do some hearing tests now. All right. So I'll do the Weber test. Yeah, I'll do the Weber test. I said I would. Can you hear that in both ears?
Yes.
Equally in both ears?
Yes.
Okay, so Weber test is good. All right, I'll do the Renee test now. Can you hear that?
Yes.
Okay. Can you hear that?
Yes.
Which is louder?
The second.
Okay. The same thing on this side now. Can you hear that?
Yes.
Can you hear that?
Yes.
Which is louder?
The second one.
Okay. All right. One more. Can you block this ear with that hand and close your eyes? Okay. And can you hear this?
Yes.
Okay. Let me know when you can't hear it anymore.
Okay.
Okay. Go ahead and switch ears. Can you hear it in this ear?
Yes.
Okay. Let me know when you can't hear it anymore.
Right there.
All right. That's sufficient. You can go ahead and unblock your eye or ear. All right. Let's go ahead and inspect. Well, I got this piece on this. Let's inspect your nose. Can you tilt your head back a little bit? All right. Do this. Open up that side. All right. The nasal mucosa looks pretty normal there. Let's do the other side. And I don't see anything out of normal there either. Okay. Let's do the sinuses now. Let me turn that off. Do the sinuses. All right. Do the maxillary. Any tenderness with this?
No.
Any tenderness with this?
No.
Okay. Okay. Let's do your throat now. Get out a clean tongue dispenser. Can you tilt your head back just a little bit? Open your mouth and stick your tongue out. Hold on, let me get a light. That might help. Sorry. All right. Okay. Okay. Can you say ah? All right. Can you put your tongue up? Okay. Look over there.
Sorry.
I noticed that. All right. I think you're pretty good. Thank you very much.